Joining us now, Wayne graduated in osteopath in 1985. In 1987, migrated to Australia. Wayne has taught both undergraduates and postgraduates, and included 4 years with the Victorian Uni as a senior lecturer. Wayne's been president of the Australian Osteopathic Association and is here to talk to us today about an e-learning package he's developed for practitioners. So I'll hand over to Wayne.
Thanks, Luke. Is everyone still awake? I started feeling sorry for you this morning after Professor Malcolm Sparrow when he said that fraud is a miserable business. You know, that miserable. No? Everyone happy? Okay. Until now, there hasn't been a training program for ancillary providers about fraud awareness. That needs to change. And that's why I'm here to talk to you today. So before we go into that, please let me tell you my story. I got to be talking to you today. Well, as Luke said, my professional career started in 1985 in the UK, London, where I qualified from the British School of Osteopathy. And became an osteopath, and I worked in private practice. And I also worked on my own and also as an associate in another practice. Also got invited to teach at the British School of Osteopathy from where I graduated. So 2 years later, a great opportunity came about to travel to Australia and migrate here with my wife, who was also an osteopath. And in 1987, I took up the position at Philip Institute, or was Philip Institute at the time, and now it is RMIT University, to teach on one of the only osteo courses in the world that was government funded. So that was a great opportunity, and I really enjoyed teaching, loved teaching. And when that contract had finished, I began working in private practice again. And later on, I joined the Victoria University, where I taught as a senior lecturer to osteopaths. And I also became interested in acupuncture through a series of events, and decided I was that interested in acupuncture that I think I want to become an acupuncturist too. So I went back to RMIT University, this time as a student, and completed a master's degree in acupuncture. And somewhere in the middle there, I also was the president of the Australian Osteopathic Association. So I finished my acupuncture master's degree, and then I set up my own practice, the one I have now, in Beaumaris, Victoria. So in that practice, we have a number of other health professionals, and we practice many modalities in that clinic. As well as being a private practitioner, a health practitioner, an osteopath, an acupuncturist, I also have another business, CPD Health Courses, which we produce online programs, blended programs for health professionals. And this is why I'm here today, to talk to you about that. So I haven't really explained why I'm here though. And that's what I'm going to do now. So on December the 14th, 2011, my practice received a call from HCF. It was going to be audited. And as Stuart mentioned before, you start worrying then when you get that call. And a receptionist walks in and said, HCF have been on the phone, and they want to come and audit the patients, a few patients that you've seen over the last year and a half or so, and they're coming next Wednesday. Next Wednesday? What? So I had no idea this was possible. I had no idea, after 27 years in practice, teaching at 2 universities here, that was possible, that I could be audited by a private health fund. The tax office, yes, not private health fund. So the day came, and 2 investigators or auditors came into the clinic, and they produced a list of patients that they wanted to look through the records of. It was a learning experience, absorbed every minute of it. And we went through the records of the patients that they wanted to see. And we got to the end of the audit, and they informed me that I passed with flying colours. Relief. Fantastic. So, after the relief, I asked them a few questions, we had a chat. I said, so, how many people actually fail an audit? How many people, you're going to, they were down from Sydney, so we're going to see other health professionals in Melbourne, and want to know how many people actually fail. I want to make myself feel better, really. But, they said 50% of people they will audit will fail the audit process. That's a shocking number. 50%. There's something wrong with that. I started thinking, what is going wrong? Why would 50% of ancillary providers be failing the audit process? Now, when one starts thinking about a problem, you can also try and find the answer to that problem by looking at the things that ancillary providers do well. What do ancillary providers do well? Let's see if we can apply that to the problem that we have, that they're failing compliance audits. So I got started thinking, what do we do well? Well, we train as osteopaths, chiropractors, physiotherapists, podiatrists and so on. Trained for several years. We're good at training. We're good at that. We're good at conforming to things that we're taught how to do at a undergraduate level. They train us to do things. We're taught how to do particular skills. We learn about particular subjects, anatomy, physiology, dentistry, physiotherapy, whatever it is, exercise therapy, whatever it is, we're taught and we're trained and we do well at training. The next feature of something that we do well is that we're tested. We're tested after we train. That's a big part. Everyone who is an ancillary provider has been tested ad nauseum. In my case, I'm tested twice, being an osteopath and an acupuncturist. So train, we test, and then we do. That's the order of events. That seems to work. We train in whatever skills we need, get tested, then we're good to go. That is a model that works. What are the features of our training and testing? Safety. That is of utmost concern. You ask any health professional here, what's more important? Your safety or your treatment outcomes? The answer will be your safety. Safety is much more important than treatment outcome. You would rather be safe when you're treating a patient, not cause harm, than get someone better. If it was a choice, you have to go with the safety. Obviously, you'd like to go with both, but if you couldn't, it'd have to be safety. So that is something that we do well. We do understand safety when it comes to treatment and outcomes. We're very good at systems. Why are we good at systems? Because we follow them every day. In practice, from the minute a patient comes in, whether they're a new patient or a repeat patient, we have a system that we follow. That system, it starts with the patient case history. We ask a certain number of questions, we get a response, we then ask certain other questions depending on that response. You can't ask anyone to do that who's not been trained, because the questions that we ask depend on the patient's responses. They're a flow chart. So we have a system of asking questions in our case history. We also have a system of examining a patient. Examine a patient according to their case history, to their presenting symptoms. We also have a system of treating that patient, depending on all the other things, the case history taking and the examination. So we follow systems very well. Why? Why do we follow systems and we do very well at training, testing and doing? The answer is this. It goes back to the Venn diagram from our maths day.